is a somewhat novel drug delivery system that's been developed by Janssen. Basically what it is a drug-eluting pretzel-shaped device that is placed into the bladder of patients through the urethra. So it's a pretty flexible piece of plastic that is inserted through a catheter in the clinic and then forms into a pretzel so that it doesn't, can't be urinated out during micturition. So it's placed every 3 months and continuously spills a drug called erdafitinib, which is a small molecule inhibitor of FGF or fibroblast growth factor receptor, which is thought to drive cancer in non-muscle invasive bladder cancer, and particularly in low-grade non-muscle invasive bladder cancer. Erdafitinib is actually FDA approved in the metastatic setting for bladder cancer, with the understanding that it's really mutated in a fair minority of that patient population, so 15 to 20%. But in the patients that do have FGFR mutations, it shows good efficacy. The issue is that when given systemically, erdafitinib has a fair amount of side effects, especially hyperphosphatemia, diarrhea, which can be dose limiting. On the flip side, low-grade non-muscle invasive bladder cancer has very high rates of FGFR mutations, 60 to 70%, but you don't want to give a toxic, potentially toxic medication systemically to a patient population that with a localized disease. And so the idea was to give this or intravesically in a way that localizes the symptoms. And sure enough, on their side effect profiles, it looked very favorable. I mean, pretty similar to other intravesical therapies such as intravesical chemotherapy or BCG. Only 1% or 2 patients out of the 40 or so or 25 or so had discontinued due to adverse events at 1 year, and 1 patient had a serious infection of pyelonephritis and sepsis, which we can see with any intravesical therapy. So in general, I thought the side effect profile and tolerability looked very good. This is incredibly early time points. I mean, only 25 of the patients had 1 evaluation at 3 months. But at that point, the recurrence-free and complete response rates were over 80%. Only 1 of the patients in this study at this time point had follow-up exceeding 12 months. So very, very early, but I think certainly given the complete response rates being that high and the side effect profile being favorable, I think it certainly warrants further study. These are pretty exciting data, I think, and understanding that BCG-unresponsive high-risk non-muscle invasive bladder cancer is an area of huge need. The gold standard treatment for these patients is radical cystectomy, which is life-altering therapy, but a very effective one with 90% cure rates at 5 years. TAR-200 is a gemcitabine eluting intravesical device, similar to TAR-210, which we just talked about, where it forms into a pretzel and is retained in the bladder, which allows a more prolonged drug release and exposure to tumors in the bladder. And this study was, as you said, looked at 3 arms, the combo arm, and then TAR-200 and cetrelimab alone. And basically the cetrelimab arms were not terribly effective, and the side effect profile was a little bit worse than TAR-200 alone. And so those have actually been closed to accrual because the therapeutic signal was just not worth it given the toxicity profile there. But the TAR-200 alone arm looks very, very, very promising. So just to give you an idea of some of the other therapies in this space, pembrolizumab, adstiladrin, and then off-label intravesical gemcitabine docetaxel. The 12-month complete response rates for those are somewhere around 30 to 40%. And while it's early, the signal here shows a complete response rate in excess of 70 or 80%. And that's getting close to 12 months of follow-up. So this is a really, I think a lot of urologists and urologic oncologists are very excited about this therapy, and it's certainly an area of need, and the safety profile and tolerability profile looks very favorable, almost similar to BCG and other intravesical therapies. So we might this I hope continues to show a good signal, and we can move forward with FDA approval quickly.